Welcome to this explainer. Okay, today we're going to tackle something that, honestly, almost all of us will face at some point in our lives, an intimidating, jargon-filled medical report. Specifically, we're going to take a real line from an actual MRI report about the spine, and we're going to break the whole thing down into plain, easy-to-understand English.
I mean, have you ever opened up a medical report, read the results, and thought, am I looking at a completely different language right now? If you've ever felt totally overwhelmed by medical jargon, I want to reassure you right now that you are absolutely not alone. It can be incredibly stressful to read highly technical terms about your own body and just not know what they mean. But hey, don't worry. Absolute clarity is literally just a few steps away.
All right, let's dive right into it. We're going to look at this specific excerpt. This is an actual impression pulled straight from an MRI report. It reads, diffuse bulging of L5-S1 disc, causing indentation on theca and lateral recess. It sounds super serious, doesn't it? But we're going to look closely at this single, dense sentence and we'll piece it apart word by word together so we never lose our context. By the end of this explainer, you'll know exactly what this means.
So step 1. Locating the L5-S1 disc.
L5 to S1. That's just the medical way of saying the absolute lowest point of your lumbar spine. It's the exact junction where the last vertebra of your lower back, which is L5, meets the sacrum, known as S1. Think of it as the very base of your spine. Now, it's pretty important to note that this specific junction is an incredibly common area for everyday wear and tear. And why is that? Well, because it acts as a primary pivot point for your movement. It carries a massive amount of your body's upper weight, including the burden of all our, let's be honest, less than perfect posture choices. So seeing this region mentioned on an MRI is completely standard.
Moving right along to step 2. What exactly is diffuse bulging?
Diffuse bulging happens when the outer layer of a spinal disc extends outward broadly beyond its normal, healthy boundary. To really grasp this, let's use a simple mental model. Imagine a slightly underinflated car tire bearing the heavy weight of a vehicle. Or, even better, think of a compressed jelly donut that you're gently pressing down on with your hand. The filling doesn't just shoot out of one specific hole in a sharp rupture, right? Instead, the whole outer edge of the donut spreads outwards evenly in a broad, wide curve. That broad spreading, that is exactly what diffuse bulging means for your spinal disc. It's just a general, outward flattening.
All right, step 3. The theca and lateral recess.
Okay, the meningica. It sounds super complicated, right? Like some highly complex anatomical term. But honestly, it's simply the protective, fluid-filled sac or sleeve that surrounds and houses your delicate spinal cord and nerves. It's basically the secure packaging for your body's main electrical cables.
And then we have the lateral recess. This term just refers to the little side doorways, or side channels, in the spine. These are the specific exit routes where your nerve roots branch off from the main column and leave the spine to travel all the way down into your legs. So when you hear lateral recess, just think of them like the side exits branching off a main hallway.
Which brings us to step 4, the mechanical impact.
Let's put the whole picture together and walk through the cause and effect step by step. First, as we established, that L5-S1 disc at the very base of your spine spreads outward, much like that compressed tire. Second, because it's spreading out so broadly, that bulge encroaches on the limited space inside the spinal canal. And third, as it takes up more of that space, the edge of that spreading disc gently presses against or indents that protective nerve sac we call the theca, as well as those side channels, the lateral recess. It essentially just means the expanded disc is gently nudging into the space where those nerves live and exit.
So look at what we've done here. We've taken an entire terrifying-sounding medical sentence and boiled it down to 3 super approachable facts. First, the lowest disc in your spine is spreading out broadly. Second, it's gently pressing on the protective nerve sac. And third, it's also pressing on the side channels where your nerves exit. That is exactly what your MRI report is trying to tell you, completely stripped of all the intimidating clinical jargon. I really want to conclude with a warm reassurance here. Understanding your own anatomy is the absolute first step to feeling better and taking control of your health. Knowledge literally takes the fear out of the equation. If you found this breakdown helpful, please like, share, and subscribe for more useful explainers. And if you are dealing with physical discomfort, we definitely welcome you to visit our clinic for any physical therapy and emergency pain relief treatments. But I want to leave you with this one thought. If deciphering just a single sentence of your MRI empowers you this much to understand your own pain, imagine what the rest of your body is trying to tell you.